All right, well, good evening, everyone, and thank you for joining this year's launch of the inaugural Real Men Wear Pink, a Virginia campaign. For those of you who don't know who I am, my name is Amanda Darling Thompson. I am the Director of Development for the American Cancer Society, and I'm joined this evening by many other staff from across the state, a few special guests, and of course, the Real Men Wear Pink ambassadors that have already committed to being a part of this special fundraising campaign. Hopefully, tonight's program will be both meaningful and resourceful to you all. It is a short program, but whether you have just signed on to participate in this year's campaign, or you're still considering participating, or if you're an experienced ambassador and already a well-known leader in the fight against breast cancer in your community, I hope you will find it helpful and enjoyable. But honestly, we have quite a mix among us tonight as far as new to the campaign and also not new to the campaign. So welcome to everyone. But because we do have some new ambassadors on with us today, I do want to start by sharing some very basic information about what Real Men Wear Pink is, the history of the fundraising campaign across the state of Virginia, and what it is that makes this particular campaign so important to the American Cancer Society's mission and fight against breast cancer. We're also privileged tonight to welcome one of our local ACS-funded researchers as this evening's keynote speaker. Dr. Roger Anderson from the UVA School of Medicine is with us. We will talk a little bit about our 2021 campaign specifics, acknowledge our corporate partners, reveal our ambassadors, many of you on the line tonight, and finally, we'll candidly hear from one woman about her personal journey with breast cancer. And so I just want to start again by kind of talking through what Real Men Wear Pink is. And we know many of you have participated in this before, but Real Men Wear Pink gives men an opportunity to be in a leadership role in the fight against breast cancer. Community leaders around the nation use the power of pink to raise awareness and money for the American Cancer Society's breast cancer initiatives, including innovative research, patient services, and education around screenings and risk reduction. It's just one important way that the American Cancer Society is attacking breast cancer from every angle. And so, in 2020, for the first time ever, female breast cancer has surpassed lung cancer as the most commonly diagnosed cancer worldwide. Despite this, the death rate from breast cancer has dropped by 41% from the year 1989 to 2018 as a result of earlier detection through increased awareness and mammography screenings, as well as advances in treatment. And so Real Men Wear Pink in the state of Virginia began in 2017. It started elsewhere in the country, and we brought it to Virginia in 2017. Collectively raising more than $100,000 annually. As a nation, we raised $92 million in 2020 from our Real Men Wear Pink campaigns across the country. And as many of you know, in 2020, we had 3 Real Men Wear Pink campaigns in different markets, the Virginia Beach, Hampton Roads Market, in Harrisonburg, and in Lynchburg. By combining these 3 successful market-based campaigns for 2021, we are launching a statewide initiative, and we're able to provide our ambassadors and our corporate sponsors with some increased exposure, additional visibility. We're also able to have a larger footprint in the space of fighting breast cancer, along with our Making Strides events in both the Richmond and Hampton Roads market. We can have ambassadors join our Real Men Wear Pink efforts from anywhere in the state. It doesn't have to be in one of these 3 markets where we've had successful campaigns previously. And so as an ambassador, for those of you that are new to the campaign or still considering whether or not to join, first and foremost, we need you to register. And I know that there are several of you joining this evening that haven't done that yet. So please make note of the website URL that's highlighted in yellow, or you can reach out to any of the ACS staff on the call tonight, and we'll get you registered with just some very simple and basic information. But after you've registered, you'll want to begin reaching out to your professional networks and your social circles to let them know that you're participating in this year's Real Men Wear Pink campaign and that you're hoping to have their support. During the month of October, you're going to wear pink, and you certainly don't have to sport a pink wig and tutu like Nick is in this picture. Any amount of pink is acceptable, from a lapel pin, a tie, a t-shirt. It's completely up to you. By signing on to be a Real Men Wear Pink ambassador, you're committing to fundraise for the American Cancer Society, and you will personally set a goal of hoping to reach a minimum of $2,500. And we've got several on the line tonight that have already reached that amount and raised that much. So we're excited for where we currently sit with our campaign, and certainly where we will be headed in the next couple of months. Throughout the month of October, be sure to share your reason for participating in the campaign. Our reasons are all very personal, and we want to make sure that you're sharing that on social media, that you are taking the opportunity to talk about what the American Cancer Society is doing in the fight against breast cancer, and that you're sharing that thank you message with your donors. And you know, those donors that are supporting the American Cancer Society despite the lasting pandemic. Also, please know that we are still recruiting ambassadors. We would encourage any gentleman that has been affected by cancer, by breast cancer, to consider becoming an ambassador and being a part of the statewide campaign. Because we're asking you to fundraise on behalf of the American Cancer Society, we feel it's important for you to know what we do with the money that you raise. Every single dollar raised through the Real Men Wear Pink campaign helps save lives from breast cancer through early detection and prevention efforts, innovative breast cancer research, and patient support programs. Many people will have heard of the American Cancer Society, but they may not know exactly what it is that we do and what we fund. Cancer information specialists are available 24 hours a day, 7 days a week, and 365 days a year by calling 800-227-2345 or by visiting cancer.org. We've provided nearly 490,000 free rides to treatment and more than 500,000 free nights of lodging for cancer patients and their caregivers when their best treatment is away from their home. More than 24,000 patients have successfully been guided through the healthcare system by our patient navigators. And currently, the American Cancer Society is funding 153 research grants specifically related to breast cancer in the amount of nearly $103 million. As we talk about the fact that this campaign funds mission critical work of the American Cancer Society, I would like to introduce our keynote speaker. Again, very excited to have Dr. Anderson. He is a professor of public health sciences at the UVA School of Medicine and serves as the associate director of the UVA Cancer Center, where he leads population science research on cancer prevention and control. He is trained in public health, and his research focus is on breast cancer disparities in rural and underserved populations, with the goal of improving access to care and reducing later stage breast cancer in the Commonwealth and across the United States. So Dr. Anderson, thank you so much for joining us this evening.
Thank you, and I wish we could all be here at this meeting in person, and hopefully that will happen soon after the pandemic recedes. Again, hopefully soon. But it's very good to be here, and it's great to be part of the fight against breast cancer. And also want to say, a really heartfelt thank you to all of the people who work really hard raising funds for this important disease. And as you stated, Amanda, it's the #1 cancer. We are very fortunate that it's receding. The death rates have been dropping over the last 10 to 15 years. But I'd like to, one of the things I'd like to point out in my presentation and from my research is that even though those are national averages, we still see gaps in care. We still see areas of the US and in Virginia where those breast cancer screening rates, for example, are not really increasing. The breast cancer death rates are not really decreasing as fast as they should. And those tend to be the underserved rural areas of the Commonwealth, as well as any other place in the US that you go. It's just, there are many other barriers to getting services. And so one of the things that I've been looking at in my research is what exactly are behind these and how can we fix it through policy, through working with state government, with local health districts to improve access to care. And so the research that I have funded now through the American Cancer Society, and again, one more time, thank you all for making this possible, is really looking at screening. And so if you could show the next slide on the presentation. So this is a map, and forget the lines for a minute, because those lines kind of show you the catchment area of the University of Virginia Cancer Center, but we really focus statewide as well. But this map shows you the screening rates, breast cancer screening rates for women insured by Medicare. And that would be, women who are age eligible for breast cancer screening. And if we were to look at everybody, and it's really hard to get data on the entire population for screening, those that are insured by Medicaid, insured by private insurance, and those who are uninsured, the map would look a little different and probably even worse. But again, these are all insured women, but we can see across the Commonwealth of Virginia that your likelihood of being screened varies somewhat based on where you live. And so if you look at the far southwest corner, or not corner, but area of Virginia, we see that only about 50 to 54% of age eligible women are being screened on an annual basis. If you look over, more north, you see some of the orange counties, and the rates are higher. Nationally, the average is around 65 to 75%, which is still not all that great. But you can see that we have real differences across the state in the percentage of women who have actually had a recommended mammogram. And so that really is sort of behind the research. Is why is that? What's going on? Is it awareness, lack of access to primary care to get appointments for mammograms? Is it and we already know some of the things that are behind this, like distance. If you have to drive more than 30 or 40 miles to get a service, any sort of service, your chances of getting that service are less than if you're only going, say, 15 or 20 miles. So we know distance is important, but and we know health education is important. And again, we know finances are important, but these are all insured women, and under the Affordable Care Act, their breast cancer screening should be free. So what is the problem? And so what we're doing in this study is we're doing an inventory of the communities to understand, to find out what are the screening facilities in each of these communities, and what are they like? And so it could be that some of these screening facilities only accept certain insurances. Maybe they only have certain hours of operation, don't have weekends. Maybe they have, health fairs that are really attractive and reach out to communities. Maybe they don't have those. Do they have marketing departments that really advertise their services? Do they send reminders to patients, and how do they connect with their patients? And so that's really what we're doing now, is to try to understand what are kind of like the best practices for community, because some of these communities are really small, but they have really good screening rates, and some of them are same size and have low ones. So what's the big difference? And that's what we're looking at now. And maybe on the next slide, I can show you some of the data points and the things that we're collecting about these centers. So the first thing is like the organization and the resources. So what type of organization is it? Is it public or private? Is it a large organization or small? Are these screening centers part of, for example, a hospital system that could have really good resources and staffing, or is it a standalone clinic? And that's really and what kind of capacity do these sites have? How many machines do they have to screen? How many staff and technicians and physicians and nurses do they have? So really understanding the capacity to provide mammograms and the demand for them. So maybe we'll find areas where screening and uptake is really low, but it's also potentially because the capacity isn't there to really do it. And it's interesting, like these sites, they really don't look at that kind of thing. Like, well, do we have enough machines? Basically, it's oftentimes a business decision on how many machines you have. So the next thing we look at is scope of services. So some screening sites do screening and diagnostic, and do all of that in a single visit. And so someone comes in and has a mammogram performed, you get the test results in the same day, and then decide whether you need to go on and get another test. What kind of outreach and marketing is there? Do these practices have? What are the screening intervals that they use? Do they use ACS recommendation intervals, which is 2 years, or U.S. Services Preventive Task Force, which is annual? I mean, I guess I flipped that around. So it's ACS is annual, and USPSTF is biannual. What kind of patient reminders and communication do they use? And how many technicians and trained staff do they have? And then are the screens read by one person only? Are they double read? In terms of the quality, and then looking at the sort of from the patient's perspective, the ease of accessing that clinic and their satisfaction. And so we think that these things are one of the factors that could be really important to understand in terms of how what screening rates there are in the community. How large are their service areas? So, as you can imagine, a well-equipped center with a lot of staff could serve a large area. One that's just a standalone clinic that might not have the resources might be struggling and might not be able to really serve the area that really is in need. And so that's what we want to study, and then to work with government and local health districts to help improve the quality and the quantity of the services that are available. So we're right now in the middle of this study. We have studied 370 clinics so far. And so this goes beyond Virginia. It also includes part of West Virginia and Eastern Kentucky. So we've studied 300 and I think it's 50 or 70 clinics. We've conducted surveys with them. And so we're right now in the middle of data analysis. But we just started our data collection, and then COVID came. Unfortunately for all of us. And so we had to slow down our research a little bit, but we also decided that COVID actually presents an interesting opportunity for us to understand how are these clinics and screening centers responding to COVID. And that could be another, I think really telltale indicator of how strong the centers are. And, sometimes the weaker communities, these clinics can be don't have the same resources are the first ones to fold, and that even increases the disparity, right? So the next slide, I'll go over some of our survey results with you. So we surveyed 104. We had surveyed all the facilities. We received 104 surveys back, and this was around December, January, February of 2020, just as the pandemic was really in full force. What we found among these clinics and sites, about 85% of the screening sites had reduced their screening services. Some of them continued to do diagnostic procedures, but 85% of them suspended the screening procedures. And about half of those went down to actually zero services altogether. So here we have 56% of these sites that were really providing no screening or diagnostic services whatsoever during, this pandemic. About 32, so roughly a third of them, had canceled community events. If they were holding health fairs, they canceled those. And it's understandable that you have to pull back when you're faced with a pandemic. 12% had cut their marketing and outreach budgets. We had 21 didn't answer, didn't know. The good news, I guess, is that most of these clinics rebounded pretty quickly after the vaccination started to take hold, and we were able to kind of reduce the curve of the pandemic. But 77% had returned to nearly 75 to 100% of what they were doing prior to the COVID pandemic. So they were back up and running by January 2021. Most of these, or about 50%, 55%, so a little better than half, had during the pandemic, when they were reducing services, called patients ahead of time, rescheduled them, let them know that they would call them in the future to reschedule. So that's really good, because you're not dropping the ball. You're not leaving people who need to be screened sort of unattended. You're saying, look, we can't do it right now, but in a couple of months we'll call you back in and we'll screen you. But that was only 55%. So there was 14% of these sites waited for the provider or the patient to request a new appointment. So that's what I call like the ball dropping, because now you've basically put it back into the hands of the person who needs to be screened, and now they have to call you up and say, gee, I was scheduled 3 months ago, but I need a new appointment. And when should they make that call? Who knows? So there are differences, as you can see, that, in how we respond to this challenge. About 17% did not have enough personal protective equipment, and that really would hinder patients coming in. And those limitations tended to be the N95 masks, the sanitary wipes for wiping down surfaces, face shields for providers. So that's, I think there's a significant amount of supply of some of these basic, some of the basic equipment and supplies that people need. Limited seating and waiting rooms. So how did they handle the pandemic? There was limited seating and waiting rooms. Most of them had that. Physical distancing, 62%. Decreased patient volumes, remote check-in. So those were the more common measures. And then I think really interesting is, after the pandemic, when the screenings resumed, 67% of the clinics went back to their pre-COVID normal, which is good. But now think about this. They now have a backlog of women who needed to be screened, right? And so how do you catch up? But they're not doing that, because only 67% said we just went back to our normal routine. A few had expanded hours, 18% expanded, and a few had opened up weekends. which is really good for trying to get working through that backlog. So this, I guess, is maybe a nice way to, or interesting way to show how these sites can really be different, even though they all do the same thing. They perform mammograms and screening and diagnostic. They can have different organizational strengths and capabilities that can affect access. And to the extent that those strengths and weaknesses vary by rurality, by affluence, by poverty, you can then begin to see how those maybe in the poorer regions might end up with the weaker sites that close down first, that don't resume on when they could, and so on. And I'm not blaming them. I'm saying these are just outcomes of underinvestment. Anyway, so that's basically what we're doing now, and we still have, I think, 2 years or a year and a half left. We have a small team doing this, but it's very important to us because we think we can really learn some really good things from the study. So again, thank you all for your great support, and thanks to the American Cancer Society, for funding our study and all the other studies that they fund across the country. So I'd be happy to answer questions or.
Sure. I know we don't have any questions right now. We did have 2 comments in
Sure.
the chat box, just to thank you for your research, Dr. Anderson, and Rob Bosch has made mention that data is so important to helping us understand where to focus on, and just where we need to be able to put those interventions in place. And so those data key points that you're collecting will definitely help figure out the best path forward in increasing these screening rates.
Yeah, well, thanks. And I mean, it's really, I found it actually, it's amazingly hard to pull together the data that we're getting. We're collecting not only survey data, but we're also looking at Medicare data. And just to kind of get down to this level of the county and to sort out clinics and what providers are involved, I've worked with Medicare data for 25 years, and this is one of the hardest ones I've ever done. And it's because of the way that the services are billed. And it's just but I think we've solved the puzzle, and I think this will be really good. But I wish we had other groups in this, because right now we're really only looking at Medicare in terms of the claims. Our survey is survey for everyone, but there's other insurance groups, and it's just really hard to pull together a really big, nice data set that's inclusive of everyone. And that's still, I think, a problem with our US healthcare system. But
Ken, I saw you come off of mute. Did you have anything you wanted to add?
Yeah, I was just going to ask a quick question of Dr. Anderson.
Sure.
After hearing him go through all this, first of all, thank you very much for all the work that you do. What do you expect this data from the survey results and all in your 2 or 3 years of research? What do you expect it to do? What do you think will come out of this?
Yeah, so what we're doing is we're identifying best practices. So what are the organizational traits and qualities and resources that are linked to or associated with the best outreach in the community and the best uptake, and then we're going to find those that are associated with the worst as well. So we have the best performers and the worst performers, and then for all of the sites that we have, we're going to rank them, and then we're actually going to give a report and reach out to all of the sites, and obviously confidentially, we're not going to say so-and-so is better than you are, but we're going to say what we've learned is that by having, these kinds of policies and having these kinds of patient reminder systems, or having community health fairs, is really important to improve uptake. So we want to have some very specifics that organizations can do to either put on their wish list for investment or to make changes now. We can also work with the state and local governments to so I really think at a root of a lot of these problems are investment issues, that you have some small standalone sites that are just getting by on very little, and then you have some that are really well funded through large health systems. So we really want to identify where, in some of these areas where the screening uptake is really low, we have to fix that. And it might be, the combination of marketing, community education, and improving access to your services, maybe having a patient navigator to call you and say, hey, are you coming in? Let's get your mammogram done. Maybe transportation needs. So we're going to really look at what are the best practices and then find out specifically what sites could do.
Thank you.
So, Dr. Anderson, is going to be any research done to determine if the suspension and reduction in the screenings leads to detection of more advanced stages in the future?
Yes, that's being done around the country, but that's one thing that we're particularly interested in here at UVA as well. There's an estimate from NCI that the pandemic resulted in sort of something like 10,000, cases not being found early enough. And so we want to look at how that, at least in the region that we're studying, what were the effects of the pandemic on missed screenings and later stage tumors. And we should be able to find that. We won't have the data yet on that for another year and a half, based on the lag and the time that you get the data from the clinics. But yes, that's a really important question. Question.
And very relevant. So once again, Dr. Anderson, thank you so much for taking the time out of your evening.
Oh, it's a pleasure.
Out of your work to share the details of what your team is working on, and also your appreciation for these American Cancer Society fundraisers.
Well, great. Thank you. And I couldn't do this without everyone's support. So
thank you. All right. Before Dr. Anderson spoke, I shared a little bit about the history of our Real Men Wear Pink fundraising campaigns in the state of Virginia, and it's no surprise that 2020 was an extremely challenging and difficult year for the American Cancer Society, not unlike other organizations. Despite the challenges put forth in 2020, though, as a result of the never-ending pandemic, we were able to continue with our work in the fight against breast cancer. We would not have been able to do this without candidates and ambassadors such as yourselves through the Real Men Wear Pink fundraising efforts. And so now that Dr. Anderson has given us a glimpse into the kinds of work that the kinds of research that's being funded by the American Cancer Society, I want to talk a little bit about this year's campaign. While today marks the official launch of this year's campaign, we're already out of the gates with 17 committed ambassadors and nearly $14,000 raised through both individual contributions and corporate sponsorships. A couple of our experienced ambassadors are even hosting fundraisers in the next couple of days and the week ahead. We also want to take this opportunity to recognize and thank the corporate partners that have signed on early in support of this year's campaign. So Billy Kraft Chrysler Dodge Jeep Billy Kraft Chrysler Dodge Jeep Ram car dealership in Lynchburg, Centra, the health system also in Lynchburg, and Dodson Pest Control have all committed at varying levels of corporate sponsorship for this year's statewide campaign. And this next slide recognizes the sponsors for one of those fundraisers that I just mentioned that happens tomorrow. In fact, Roberto Casey with Casey Kia is hosting the annual golf tournament, and you can see the long list of corporate sponsors in the Hampton Roads market for this fundraiser. And then the next slide, just as the previous, does the same for our mixed doubles tennis tournament hosted by Gary and Denise Mignona. You can clearly see by both of these slides that fighting breast cancer through our Real Men Wear Pink efforts and our ambassadors is truly important to our community partners across the state. It's certainly not too late to ask others to come on board as a corporate sponsor. Our partnership opportunities can be found on the front page of the website, and any sponsor secured by an ambassador can be credited to your fundraising total. So if you don't see somebody listed and you want to make that ask, or have assistance even making that ask, be happy to help you with that. And so while I mentioned earlier that we still are actively recruiting ambassadors, it is time to share this year's already committed Real Men Wear Pink ambassadors. And so first, and in alphabetical order, Rob Bosch, who is the Senior Director of Acute Care and Nursing Support Services with Centra in Lynchburg, Stephen Bullock, who is the Paralegal and Deputy Export Control Officer with Framatome, Major Thomas Carter with the Lynchburg Sheriff's Office, who is going to, I believe, come off of mute and tell us what his addition to the Sheriff's Office officer uniforms looks like for this year. Major Carter, you are on mute.
There we go. Be glad to do that. You know, last year when we got into this, of course, the pandemic gave us something that we weren't ready for. So we had to come up with something to wear pink. So we did our mask, you know, doing the pink mask. And we said this year we got to top this, although since it's back, we're going to still have pink masks. But we decided to try to live up to our formula, which is the power of pink plus commitment plus partnership equaling success. So we wanted to be able and have our people in the field do the exposure part of it. So with our patches, we decided to change them. So in October, we're going to change our patches over to pink patches. Let's see if I can get it. Like
that is wonderful.
So all of our deputies will be wearing the pink patches on their uniforms during October. They've already got, in fact, they all just came in yesterday and they're going to be ready to go. So we're going to be double pink. Let's put it that way. So we'll make awareness, you know, and hopefully raise some money for this.
All right, Major Carter, I think you're going to have to come up with a way to sell a knockoff patch because I think there's going to be a lot of people that want them. And I know you can't exactly give those patches out too freely, but that is absolutely incredible. So
You tell them to give us a call. We can take care of that.
all right, well, I would be one of those. So I love it. Thank you so much for being willing to speak up and talk a little bit about your kind of legacy in supporting Real Men Wear Pink and what it looks like for you and your team. So we appreciate that. To continue on with our Real Men Wear Pink ambassadors for 2021, Craig Colucci, who is the owner and general manager of DBAT in Virginia Beach, Tague Counts, who is the VP of Member Development with Hampton Roads Chamber, Zach Dahlheimer, who is on the phone or line or computer, as I should say, tonight, our anchor and reporter for WTKR News 3, also out of the Hampton Roads market. Roberta Dial, who is with Casey Kia as the general manager, also in the Hampton Roads market and hosting a fantastic golf tournament tomorrow. Bill Freeman, who's the division manager with Ace Hardware out of Rockingham. Kevin Hamlet, our VP and General Manager for Billy Craft Honda across the road from Ken, Dr. Alan R. Jones, who's the owner and CEO of Dominion Physical Therapy and Associates out of Virginia Beach, and Ken Craft, General Manager for Billy Craft Chrysler Dodge Jeep Ram. Nathan Kottkamp, who came on today from Williams and Mullen Law Group, is the partner and healthcare lawyer in Richmond. Chad McFadder with MSP Design Group. Gary Mignogna, President and CEO of Framatome. Connor Pritchard, Business Services Officer with Truist. Craig Granson, Senior VP of Framatome, and Scott Robertson, Sales Manager with Framatome. So those are our 2021 Real Men Wear Pink ambassadors committed to date. Again, I think we will be adding several more to this list, and do hope to do just that and double the numbers in the next couple of weeks of the men who will be wearing patches, whether or wearing pink, whether it's in patch form or mask form, or pink tutus and wigs, whatever floats your boat. So I do also want to take the opportunity tonight to share not only the introduction of our candidates and ambassadors that we do, but it's also an opportunity to really thank you for your participation and support of the American Cancer Society's mission to save lives, celebrate lives, and lead the fight for a cancer-free world. One of our breast cancer survivors could not be with us live tonight, but did want to share her personal journey in a very real and candid way with all of you.
I'm Kara. I'm married to my wonderful husband, Steve. I have 2 teenage sons, and I've been a nurse in a hospital for 20 years. Actually, 22. All surgical services, all endoscopy, OR, outpatient surgery. So in June of 2020, I turned 40, which meant it was time for a mammogram. Of course, this is in the middle of a pandemic. As a hospital nurse, that was absolutely insane and crazy times anyway. So my doctor set me up to have my yearly mammogram, and I went in the 1st of December. So I easily could have pushed this off. I have no breast cancer history in my family. I had had genetic testing done due to another health concern, so I knew I did not have the breast cancer gene, and without a family history, my chances were less than average. So I decided to go ahead and have it done just because preventative care is important to me, and I knew that it was important. So I went in the 1st of December, actually it was the 2nd, and had my first mammogram. That day they told me that I would need to come back for a biopsy and ultrasound. The 2nd week of December I went in and had an ultrasound with biopsy. So because it was Christmas and everything was busy and COVID was insane in our hospital at that point in time, it was quite a while before I heard any results. So I had taken a few days off close to Christmas to be home with my family, and had gone into the hospital one evening on actually it was December 22nd, and I went into the hospital to deliver some Christmas gifts. So while I was there, I looked up my medical records to see if that biopsy had been back, and of course it was. And I found out there at 8:30 in the evening by myself in the middle of the OR suite that I had breast cancer. It was a bit of a shock, and I didn't exactly know what to do. I didn't even tell anybody until the next morning. I really felt at peace about it because I knew I had got it early. The next morning, I told my husband and my mom and my boys that this was going to be quite a little journey that we were going on. So after multiple appointments, MRIs, oncology appointments, radiation oncology, medical oncology, MRI, plastic surgery, as well as appointments with my surgeon, I decided the best route for me was to have a bilateral mastectomy. So March 2nd of 2021, I had a bilateral mastectomy with tissue expander placement during that surgery. Since then, I have continued with my reconstruction journey, and I'm scheduled to have another surgery in December, which should be the final one. Early detection saved my life. Honestly, that is the bottom line, and that is what I want you guys to understand, that early detection is important. Because I went for that mammogram, even though it was a crazy and inconvenient time, my cancer was caught early and my lymph nodes were clear, which meant that I did not have to have any kind of chemo or radiation. The surgery was all that I needed. So, because people like you guys are going to wear pink in October and support all of the women on this breast cancer journey, it's people like you that make a difference, that make the research, that put the things out there for everyone to read about, the research and the testing and the extra mammogram locations for women to have these tests done. It's people like you that are making that happen. It's people like you that saved my life. And it's people out there everywhere that are going through breast cancer journeys of all different sorts and all different kinds. But the bottom line for me in my personal story is that early detection saved my life.
So while everyone's cancer journey with breast cancer is truly personal and unique, let's be honest, not everyone has the ability to access their own medical records in the middle of an OR suite. Kara's important message about early detection is one that can be shared far and wide. And so as Dr. Anderson shared earlier, with the cancer screening rates affected by the pandemic, we know that pre-pandemic, those cancer screening rates were not what they needed to be. And we know that they were low. And so during the pandemic, cancer screening rates continued to be delayed or altogether missed, again, as Dr. Anderson's data showed us. While not Kara's personal story to share, her message actually continues on to tell of a friend who decided to skip her mammogram in 2020 because of COVID. And very recently, and very sadly, she just received a late stage breast cancer diagnosis herself. And so while the same kind of diagnosis, the outcome may be very different because of that delayed screening. And so again, to Dr. Anderson's point, and in sharing Kara's story, we know that messages and education around prevention and early detection are extremely important to continually share. While Kara could not be with us live tonight, she was thrilled to be able to record that message for you. And she was genuinely appreciative for our Real Men Wear Pink ambassadors' commitment to the American Cancer Society and raising money and awareness. So much so that we'll likely be seeing the Holcomb boys on our Real Men Wear Pink leaderboard very soon. So on behalf of Kara, her family, breast cancer patients, survivors everywhere, along with their families, that you will never know, you will never meet all of them, the American Cancer Society funded researchers that you will be supporting in your fundraising, American Cancer Society volunteers, and all of the ACS staff on with us tonight, I say thank you. Through this year's Real Men Wear Pink campaign, you will truly make a difference and continue to help save lives. So thank you all so much for joining tonight. Apologies that we are a couple minutes long. Best of luck with your fundraising efforts, and we'll be in touch soon. Thank you, everyone.
Thank you.
Thank you.